All right, welcome everybody. It's great to be back. A lot of good things to talk about, some not so good. We're going to be going over so much took place, indictments, rallies, so many different things during our vacation. But where I want to start is with the latest on COVID cases and deaths. We're going to do a deeper dive tomorrow about what's going on a state-by-state basis. But what is increasingly happening is that this pandemic is becoming essentially a red state, blue state pandemic. We now have different enough vaccination rates in states like Hawaii, Vermont, Massachusetts, and others compared to places like Mississippi in particular, Alabama, Arkansas, that this Delta variant is wreaking drastically different levels of havoc in the more vaccinated states versus in the less vaccinated states. And the difference is only going to grow due to the level of contagion of this Delta variant, believed to be reproducing and are not somewhere between 5 and 8, the Delta variant, which is significantly more contagious than the sort of original strain of the coronavirus, believed to be somewhere in the 2 to 4, 2.5 to 3.5 range. And this is not merely a curiosity, it's actually having a real impact. And there's a new Associated Press report that nearly all COVID deaths are now among the unvaccinated. The numbers are just incredible. The Associated Press writing, nearly all COVID deaths in the US are now in people who aren't vaccinated. A staggering demonstration of how effective the shots have been, and an indication that deaths per day, now under 300, could be practically zero if everyone eligible got the vaccine. An Associated Press analysis of available government data from May shows that breakthrough infections in fully vaccinated people accounted for fewer than 1,200 of more than 107,000 hospitalizations. So that means of those hospitalized, 1.1% were vaccinated, compared to 98.9% of hospitalizations being in those who were not vaccinated. And then further, only about 150 of the more than 18,000 COVID deaths in May were in fully vaccinated people. That translates to about 0.8% or 5 deaths per day on average. Only about 45 states report breakthrough infections. Some are more aggressive than others in looking for such cases, so the data probably understates such infections. So there's a few important details here to consider. One is, at this point, there's just no question whatsoever about the level of protection that the vaccines provide, including against the Delta variant. Some might say, well, you could get sick anyway, and you could end up in the hospital, and you could die. And of course, that's true. But often the people saying that are those who don't want to get vaccinated, seemingly failing to understand that by they themselves getting vaccinated, they become less likely to pass on any of these variants to someone who has been vaccinated but might be in the 8 or so percent that has not developed antibodies. Now, one other thing, and we're going to look into this in more detail tomorrow. I don't even know about a report. We'll call it a report. It's not a study, but there is a news report out of Israel, a highly vaccinated country, that they believe there may only be 64% protection against the Delta variant for the Pfizer vaccine. Remember that Israel started vaccinating very early exclusively with the Pfizer vaccine, or at least initially exclusively with the Pfizer vaccine. And of course, when you see that and you say, oh, it was 92%, only 64% effective against the Delta variant. Some good epidemiologists, including Dr. Ashish Jha, who we had on the show a couple of weeks ago, and others have said they, as of now, are unsure about that 64% number. And sort of a two-pronged response. One, we don't really know that that's the number, and it sounds suspiciously low. It's probably higher than that, but lower than 92%. But more importantly, even though cases have started to tick back up in Israel as the Delta variant spreads, hospitalizations for now are at least not up. And that would be the vaccine doing its job, which is preventing serious illness, preventing hospitalization, and ultimately preventing death. So regardless of your view as to the seriousness of that variant, it still makes sense to just go and get vaccinated, because not only do you protect yourself, you also protect people that may be vaccinated but either immunocompromised or just in that it's on a bell curve. Antibody development is on a bell curve, and not everybody develops those antibodies. One other thing. There are always conspiracy theorists, and I've seen floating around, the people who were vaccinated and died from the vaccine. And of course, there's no evidence of that whatsoever. The vast majority of those folks were vaccinated, months before. In many cases, there's no evidence of that. But remember that that's how conspiracism works, and it should be no surprise that that's the way that some people are going to react. I got an email from an ER doctor who works in a less vaccinated red state. And he said they are regularly seeing at their hospital that, just like the national data, almost everybody who's being hospitalized, and even more so, almost everybody who's dying of the virus, was not vaccinated. And he said, I understand that it's easy not to feel sympathy for some of these folks in some sense. I mean, listen, they didn't get vaccinated. They could have. They got sick. Then they died. But he had a different take, which I think is reasonably empathetic, which is they fell for disinformation. And in a sense, we should sympathize with that. They didn't get vaccinated because they became convinced of things that weren't true. They were victimized by purveyors of disinformation. And societally, there is some responsibility to that. I get that. On the bonus show today, I'm going to tell the story from last week from my trip of a Lyft driver who told me he wasn't getting vaccinated because his mom became magnetic after getting the second dose. So that'll be on today's bonus show, but stunning stuff.